So there are 4 valves in the heart, and the most important ones of those are on the left side, which is the high pressure part of the circulation. There's an inflow valve, the mitral valve, which could narrow or leak, and there's an outflow valve, the aortic valve, which can also narrow or leak. Recent innovations in medicine have focused on the aortic valve and especially the narrowing that can occur as one gets older, aortic stenosis. If you have aortic stenosis, it can sit there minding its own business, slowly narrowing with you having no symptoms at all. But once it starts to develop a more severe narrowing, you can get breathlessness, chest pain, or start getting dizzy and have blackouts. And those are danger signals that that valve needs to be fixed. There are no tablets that can help with aortic stenosis. It needs a mechanical fix. And those come in broadly 2 varieties. If you're younger and fitter, and by younger, I mean unfortunately younger than me, I'm in my 50s. So if you're in your 30s, 40s, and maybe early 50s, then quite clearly you need a definitive operation, which is cardiac surgery. It could sometimes be done minimally invasively or through a cut in the middle of the chest. Either way, the surgeon is removing the old valve and suturing in the new valve very carefully. More interestingly, those people who are in their 80s and 90s, who clearly would not be candidates for those sorts of treatments, can now have a transcatheter valve where within about an hour of treatment, while a patient is awake, I can pass a new valve up from the groin and deliver it into position, pushing the old valve just out of the way. No sutures needed, the valve functions immediately, and the patient can sometimes even go home the same day. Now, this revolutionary treatment, TAVI, or transcatheter aortic valve, can now expand into those in their 70s, and we occasionally also do it in the 60s. Why not in everyone? Well, it's because, number one, it's a tissue aortic valve, and tissue valves don't last 20 years, even when they're surgically put in. So if you're 30, you may well need to have many more operations if we keep putting in tissue valves. So the very young get metal valves. When you're into your 50s and 60s, the surgeon may well put in a tissue valve, and then if that decides to disintegrate a little bit later, which it'll get older as well, it's not a natural valve, then we could place a TAVI inside that. But by the time you're 65, 70, if you said, no, I want a less invasive treatment the first time round, then it's very reasonable to consider a TAVI procedure there. The balance will be decided with a discussion with you, with our cardiac surgical colleagues, and with an interventional cardiologist such as myself, after a battery of investigations, because if you're not suitable for a TAVI, then you can't have one. And if you're not suitable for open heart surgery, you can't have it. There are, thankfully now, a range of treatment options available, except for tablets, which don't really work.